All right, I want to continue to move our program along. Our next program is leveraging evidence-based programs to improve campus well-being and mental health. In recent years, there's been an increase in symptoms of depression, anxiety, and eating disorders, and other mental illnesses in college student populations. Simultaneously, there's been a rise in demand for counseling services. These trends have been viewed by some as mental health crisis, prompting investigation and generation of potential solutions to serve the needs of our students. This session will highlight evidence-based programs that are assisting with the growing needs on college campuses. It's my pleasure to introduce our presenter, Bernadette Mauzurek-Melnyk, the Vice President of Health Promotion at The Ohio State University. Welcome, Bern.
Thank you. Thank you. Hi, everyone. I am so excited to be here this afternoon. How many of you are excited about ramping up your efforts in prevention? Yes. Even if you're not excited, can you please act excited for me? Because when we act excited, pretty soon we feel excited, and just like stress is contagious, so is enthusiasm. I want to start by telling you a little bit of my story, because it really feeds into why I developed a passion for prevention. How many of you are from the Pittsburgh area? Anybody? Yes, where from? Great, excellent. I grew up there, Republic, Pennsylvania, 1 hour south of Pittsburgh, right near the West Virginia border. My dad was a coal miner. We lived in half of a little company house. I'm sure we were labeled working poor, but I was born with rose-colored glasses on. I still can make lemonade out of lemons any day. That resiliency came in handy for me when I was 15 years of age, home alone with my mom when she sneezed and stroked out and died right in front of me. Now, how many of you have kids? Can you imagine how traumatic it would be for your kids to be alone with you and to see you die unexpectedly right in front of them? I suffered from terrible post-traumatic stress disorder for months. I couldn't sleep through the night. I wasn't eating. I wasn't functioning well in school. And after months of those symptoms, struggling with depression, with anxiety, I was taken to my family physician. And my cousin said, do something to help her. She doesn't look like herself anymore. He did what so many providers do today. And what do you think that is? Got out the prescription pad, wrote a script for Valium, said, give Bern one of these every night, she'll sleep and be just fine. And I remember taking a Valium that night, and I slept for the first time in months. But I woke up the next morning groggy. I just didn't feel right. And I said, I've got to gut it up and cope. But in the next 4 years, the year after my mom died, I lost a cousin who was like a brother to me in a car accident. The year after that, I lost the only grandparent I ever knew and loved. And at 19, when I was 19, my dad had his heart attack. Now, that's a lot for a teenager, right? But you know the story. What doesn't break us only makes us stronger. And as a result of what I went through, I developed a passion about becoming a nurse, then an adolescent nurse practitioner, then a psychiatric nurse practitioner, and going on to get my PhD so that I could develop and test research-based interventions to promote the mental health of children, teens, and college students. So we know what an epidemic mental health problems are today. 1 out of 5 of our students are suffering with depression and anxiety. 1,000 students commit suicide on our campuses every single year. But what happens if we could just get a little bit better about preventing anxiety and depression? Because those are the 2 top mental health issues affecting our students. I'm going to speak at APLU next month with other presidents who are crying out for mental health interventions. I was on a call last week with a couple of them. They said, Bern, we've hired more counselors. Our wait times still are not going down. Our mental health issues aren't improving. What else can we do? The answer is prevention. That app at UT is awesome. We need a menu of evidence-based prevention interventions that can be scaled all throughout the United States. Nearly 75% of our college students suffering with depression also suffer from anxiety. There's a silver lining to that story right there. Cognitive behavior therapy is good for both anxiety and depression. In fact, it's the first line gold standard evidence-based treatment for depression and anxiety. But so few get it. Why? Not enough mental health specialists to deliver it. And then a lot of counselors I interface with say, we're so slammed with volume, we don't have the time to give full dose CBT. So I have long had a philosophy: in God we trust, but everybody else better bring data to the table. We live in an era where it takes, on average, 17 years to translate findings from research, get them into the real world to improve outcomes. That's 17 years if we're lucky. Most researchers never get the chance to see what they've developed all throughout the course of their career actually be scaled and implemented. So as I said, CBT, we know it works. We have systematic reviews. We have so many studies to say this is what the students should get if they're suffering from mild to moderate anxiety and depression. If it doesn't work, or if it's severe, an SSRI should be added. But remember, the majority of students who suffer from depression and anxiety have negative thinking patterns. All the SSRIs in the world aren't going to change negative thinking patterns. CBT can. We must make a paradigm shift in this country. We live in a sick care healthcare system. That's how we operate today. People get sick, they come in, we treat them, they get better. We've got to invest more in prevention. Construction workers, would we ever send them to a construction work site without a hard hat on? Then how can we send our children, our students throughout life without cognitive, behavioral, and coping skills so that they can face life's character builders without going into mental health problems? So 25 years ago, I was practicing for a child and adolescent inpatient psychiatric unit. I was amazed. We had so many kids hospitalized on this unit, getting multiple psychotropic meds, but they weren't getting gold standard evidence-based cognitive behavior therapy. I said to the psychiatrists on the unit, why aren't we delivering this with the meds? They said, Bern, if you want to deliver it, go ahead and do that. I started to create a manualized CBT program because it was my hunch that if I could manualize cognitive behavior therapy, I could teach anybody how to get CBT to kids, to students suffering with depression and anxiety. Well, in this program, just like those of you who do CBT, we teach the students how they think directly relates to how they feel and how they behave. These are the 7 sessions in this structured, manualized program. We deliver it weekly. We go over positive thinking, forming positive thinking habits, coping with stress, problem-solving skills, emotional regulation, and effective communication. If you go through this structured program and manual, you will see All the key concepts of CBT are in this program. We teach the ABCs. A stands for learn to monitor for activating stressors that cause you to have a negative belief. Stop the negative belief, turn it around to a positive so you feel emotionally better. Mindfulness is integrated throughout this program because we know mindfulness-based CBT is better at preventing relapse than CBT alone. I don't call homework, which we know is essential in CBT, homework. Students don't want any more homework, so we call it skills building activities. Put this content into practice. Behavior change takes 60 days on average. Thought change takes 60 days of practice on average. So it's critical that the students practice these skills. We have 17 studies that support the efficacy of this program. We have studied it over and over again with the same outcomes: drops in depression, anxiety, stress, suicidal ideation. And the really cool thing about this program, we've also found it increases healthy lifestyle behaviors as well as academic performance. Recent feedback from our college students this semester that have gone through the program. I've started more positive self-talk. I've started to sleep more, even though I'm still trying to work at that. It's catching my bad habits and stopping them as best as I can. The way I look at negative situations. I've changed the way I deal with my emotions, mainly frustration and anger. I'm spending more time on my mental and physical health. We have reams, thousands of pages from our 17 studies about how this program has really helped the children, the teens, the college students that have received it. Most recently at Ohio State, we started to deliver this through a 1-credit course. The benefit of that, they've got to complete the skills building activities. Many colleges now at Ohio State are integrating this as part of the student coursework. All the College of Nursing students are getting it. Our College of Medicine first-year students all got it this year. Several other colleges across Ohio State are now starting to require it as a preventive intervention, not waiting until crisis happens. We approach this as a resiliency, skills building, coping mechanism for students. So to end, the adverse impact of not preventing and treating mental health problems in our students, severe and persistent mental illness, drug and alcohol abuse, poor academic performance, dropout out of college, homelessness, decrease in vocational performance, and even involvement in the criminal justice system. My dream is to get these skills in the hands of every children, teen, and college student across the world. I dream big. I always ask people, what can we do in the next 5 to 10 years if we know we cannot fail? And I truly believe we can create a healthier world by giving students, giving our youth these skills. So to wind up, prevention and early intervention are key. We have hope. There is evidence-based programming out there, but we have to act on it with urgency. We can't take 17 to 20 years to get evidence-based programs into our universities. So, in the famous words of Benjamin Franklin, an ounce of prevention is worth a pound of cure. Let's keep on dreaming, discovering, and delivering a brighter future for our students. Thank you.
So, Bern, a couple questions for you. I think the first one's probably not going to shock you. How do we start this and access the curriculum?
Excellent. So we are going to be starting online synchronous trainings. So anybody, it's a 4-hour training workshop. We're going to start those to put people through training so that whoever wants this can get the program and start to implement it at your universities.
I think the other question was around cost. How much does the program cost in order to implement?
Yes, it will be nominal, I assure you. We're setting the price for the trainings now. All we truly want to do, cover our costs because we need people to run this. And then we will probably have, we haven't decided yet whether we'll keep producing the books and have people just purchase those, or whether we'll just let people have the PDFs and be able to print the manuals themselves. If you're interested in the training, please contact me. Thank you.
Thank you very much, Bern. Thank you so much, Bern, for a wonderful session, and again, another tool in the toolbox as we look at how to confront mental health on our campuses.